Hey guys, Dr. Jake Tucker here, and I wanted to talk to you about something that's been on my heart lately, and that's maintenance chiropractic care. A lot of people think that the value of chiropractic care is in treating things like neck pain, low back pain, headaches. Have even seen improvements in things like bedwetting in kids or digestive issues. And all those things, while they're somewhat true, the true value that we see in the research from chiropractic is not from any of those things. Chiropractic is more about the function of the nervous system. And what we see is that when someone's nervous system is functioning at a high level, their whole health just elevates across the board. And we can actually measure that over time. So there were a few studies. One that was really, in the early 2000s was really well known amongst the chiropractic community, was this study that they did of maintenance chiropractic care patients. And they had several hundred of these patients going through maintenance care. And what maintenance care looked like for them was about one adjustment a month. And based off the research that we know now, one adjustment a month is not actually doing all that much as far as spinal alignment or restoring curves or preventing degenerative arthritis. But even just a minimum of one adjustment a month, what these patients saw was a huge decrease, over 2/3 in the amount of hospital visits that they had, less than 85% less in pharmaceutical costs. And on average, they saved $7,000 per year per person. And so over the 7-year study that this went through, that would have been about $50,000 or just less than $50,000 per patient. But it gets better than that. What we see in the new research is that when patients are looking for maintenance care and they're consistently getting maintenance care, the patients that get the most maintenance care actually have to get adjusted the least. So think about that again. The patients that have to get care while under maintenance care, they get less care even when they're coming more frequently. And so what that shows is that the more often you're getting adjusted, the more health benefits you're seeing and the more money you're saving. And so that's what we want for all of our patients. And so if you're not under chiropractic care at all, that's where we start. We need to see where your spine is so we know what it needs. Does it need maintenance care? Are you perfect? Very, very few spines that I see are perfect and need to just go into maintenance care. Most spines have problems developing that we don't feel until 20 years after the problem has already been there. And then we're starting to deal with things like arthritis that can't really be corrected, or at best can just be reduced somewhat. And so if you need a follow-up, then speak to me, like reach out in the comments or call the office. You can call my line specifically, 402-413-8825. Feel free to send me a text if you have specific questions about that. Or if you aren't in my area or you need to find a doctor that's good, I always start at maxliving.com. Some of the best doctors in the world are Max Living chiropractors. So start there. I'll talk to you soon.